Are we ready? Are you on? 1 2 1 2. Assalamu alaikum. This is Omar Regan. Hey, what are you doing? Sit down. Guys, shh, be quiet. Let me do that again. This is Omar Regan, and I'm on a hunt today to find out about the Shura Council. So I've come to the masajid here to find out, what do people really know about the Shura? Do you know? Huh? Let's find out. Do you know about the Shura Council?
No.
No.
Do you know Shura Council?
Yes. Yeah.
What do you know?
I don't know.
You know that you don't know. Do you know Shura?
You mean the Southern California Shura Council?
Oh, that's pretty good. I do mean that. How old is the Southern California Shura Council?
I have no idea.
Very important question, all right? Do you know Shura Council?
Sure, no.
No.
Do you know Shura Council?
No, but I would like to know.
You would like to know? I would like to know, because they're saying that they're 25 years old. And you guys don't know about them. And how they're 25 and been around us for 25 years and we don't know.
Shura Council where? In here?
Look, they say they're 25 years old. Same age as you. 25.
That's plus tax. That's what tax.
Does anyone know Shura Council?
Sure, Shura Council is umbrella for all the masajid in Southern California. We have like 70 masajid in Southern California.
Yes. Under one umbrella. And where's the umbrella?
It's in the city of Orange.
The umbrella is in the city of Orange. I'm getting closer now.
Oh, they've been around for 20 plus years. They're an umbrella organization for all the masajid.
20 plus years?
Yeah.
I want to know, who are they?
I think they're
Give me names.
Dr. Siddiqui.
Oh, Dr. Siddiqui.
Malik Bendelhoum.
Who?
Malik Bendelhoum.
Bendelhoum.
They help kind of announce like the dates for Ramadan and for Eid so that the community is on one page.
Mm-hmm.
They work for, I think, for Muslim community. They have, if they have any problems, they're trying to solve.
So they're problem solvers.
Right.
We found out some things. Let's get all of our questions answered today.
Assalamu alaikum. My name is Aziza Ali Regan, and I'm a newly elected board member on the Islamic Shura Council of Southern California. And on behalf of the Shura Council, I'd like to invite you to our virtual gala on March the 21st. Please join us to hear an amazing and timely message about resilience presented to us by Sheikh Muslima Pumul and Sheikh Suhaib Webb. Please join us March the 21st. Don't miss out. Assalamu alaikum.
Good morning. I'm Dr. Zachariah Azar. Welcome to our health show here on ShuraTV. Hope you're doing well. Here we are in the third week of March 2021. Spring has arrived. We hope that you and your loved ones are doing well and that you're staying healthy and informed and safe in the midst of this pandemic that we are having. Please remember to still stay vigilant. And, people have gotten the vaccines currently. So a lot of people have gotten them. And we've had over 100 million vaccines administered by now. And we'd like you to still, practice your social distancing and wear your masks out there, as there are variant strains out there. So don't let your guard down yet. And God willing, we'll see the light at the end of the tunnel. We hope that everyone is staying safe and keeping vigilant, and things are getting a little back to normal, hopefully. Today, we're focusing on a topic called functional medicine. Functional medicine is an up-and-coming type of medicine that's being practiced by doctors, MDs, DOs, and a lot of these practitioners have clinics that people can go to. And Robert Bland was the father of this new science in the early 90s, where he looked at the general trends, but specifically, he noted that generally in allopathic conventional medicine, we look at the aggregates of information and data that come to us and to the physicians and to the healthcare practitioners. And then based on those averages of numbers and blood pressure and disease incidence, we come up with treatment protocols after the differential diagnosis. So the diagnosis is made based on aggregate information that has been gathered and collated over time based on the numbers and the data. And then based on those averages, doctors will prescribe a specific treatment for you. Whereas Robert Bland said, rather than look at the averages, let's look at the individuals and the individual disease states and how individuals, whether it's on the, anywhere on that curve, has, the manifestation of disease, but maybe they don't fit on that average scale where everyone else is, just a number. So it's more individualized, and through this idea, he came up with the term of functional medicine. Functional medicine, here we have a graphic that gives you a little bit of a summary on the differences of functional medicine and regular conventional medicine. So functional medicine is basically looking at the data, but it looks at the individual, and it's more what they call patient-centered rather than doctor or disease-oriented or doctor-centered. So typically in the normal situation, you wait till you get some type of illness or some type of symptom, and then you seek out your doctor, right? So you notice, you're gaining extra weight or you can't take weight off and it's been a while, and then you go and seek the doctor, and then the doctor will look for a disease that's causing that symptom. Whereas in functional medicine, the focus is to be health oriented, where you want to balance your body so that you don't have these excesses or deficiencies. And, functional medicine focuses on the holistic treatment, meaning that it's a comprehensive treatment. It doesn't look at your body as multiple systems not related to each other, but looks at it as one organism that has interrelated relationships, interconnected relationships, and that a balance has to be achieved to look at the underlying cause of that disease. And typically, on the other side of conventional medicine, everybody's specialized, right? You go to your primary care doctor, the primary care doctor finds something wrong with your gut, or you have some symptoms that have to come, they're coming from your digestive system, so they refer you to a gastroenterologist, so then you go to a specialist that only works on the gastrointestinal system and doesn't really, worry about anything else. So then you go to him and he checks that system out. And if everything checks out and is okay, then your primary care might, refer you to a cardiologist, refer you to another specialist. Whereas on the functional side, it's one organism. They don't refer you unless there's an absolute need. And they try to look at the root causes of that symptom and come up with a game plan to either alter the excess or the deficiency that's happening in the body. And also conventional medicine, the goal is, early detection of disease. The earlier you get it with conventional medicine, the better your outcomes, right? So the earlier you diagnose something, the better it is. With functional medicine, it's more of a preventive approach. So they try to prevent the symptoms from ever coming up. So it's more of a continuous relationship with that practitioner or that doctor so that he knows you and knows your biochemical status, your hormone status, your stress levels in your body, your exercise levels, your anything that induces any type of health change, which is a conglomerate of things. There's different absorption patterns in the body. If they're not functioning properly, then that might cause some type of imbalance in your body. So these things they look at, and these are all the underlying causes of the of disease. Conventionally, of course, there's a lot of testing that's done, imaging testing, a lot of blood work that's done specifically. And then if you don't fall within the average parameters of those numbers, then you're considered to be in a disease state. And after that, there's either prescriptions given to you, there might be some procedural treatments that are given, and there also might be some diagnostic tests that are done that are, for example, endoscopy, you would have colonoscopy, you would have a stress test for your heart. These things are done diagnostically so that to make sure that you prevent disease and not let things go further. On the functional sides, they do a lot of biochemical analysis of the cellular mechanisms, the basis of all this. Because on the functional side, of course, the basis of disease agreed upon is inflammation. So any type of inflammation that is noticed in the body that has a potential to cause some type of symptom, some type of disease pattern. And also on the conventional side, more and more doctors are realizing that for example, the atherosclerosis in the arteries, the hardening of the arteries, the blocked valves, and these things are caused by inflammation. So there's agreement on that by conventional medicine practitioners as well as functional medicine practitioners that inflammation is the basic building block of disease. The more inflammation you have in the body, the more disease that'll be prevalent in the body. So that's important. So you go to the doctor in terms of your conventional doctor, and they see you, they do a differential diagnosis after doing a history and a physical on you, and then they come up with the treatment protocol. So let's take an example. Say you go with knee pain, for example. You go with knee pain to your primary care office. The doctor will check out your knee pain, we'll do some exams, and then we'll send you for an x-ray to see what's going on. They'll check your, maybe vitamin D levels, calcium levels to make sure that there's no calcium depositions in your knee, things like that. And then they'll refer you to an orthopedic surgeon to further study that joint to make sure that it's not something that requires surgical intervention. So that's the basic, roadmap of conventional medicine. You go to the primary care, then the primary care will refer you to the expert in that field depending on your symptoms. With functional medicine, you might go with that same knee pain, and what they'll do is they'll do a biochemical analysis of your body, and then they'll see what the imbalance is in terms of your bone making and bone destroying cells. They'll try to come up with the cellular mechanism of why this is going on, and if it's going on microscopically in other areas of your body as well. That's a little bit of a difference. So here we have another tree, as you might look at it. We call it maybe the tree of medicine, right? So as we can see here, Western medicine, or conventional medicine as we call it, because functional medicine is also Western medicine. Conventional medicine will treat the symptoms, and you'll have a specialist per organ, as we stated earlier. Functional medicine, it treats the body as a whole. You have the notion of the mind, the body, and the spirit. And then the identification and the treatment are based on the roots of the tree and the causes. Now, if we look at the roots of the tree, they have several different variables that contribute to health and what they look at. But, 15 to 20% is going to be your genetic predisposition. Then the rest, which is going to be, we have the nurture versus nature dichotomy. Your nature is your genetics, what's with you, and then you have your environment, the stress factors that you have, the nutrition, the exercise, your sleep, anything that affects your overall health, any trauma that you might have experienced, environmental things like pesticides, the types of food you eat. Functional medicine is something focuses a lot on food being your medicine. There's different additions and subtraction of food, specific foods, to alter your health conditions as well. That's practiced as well. So that's something that is seen quite often in functional medicine practitioners. They analyze your intake, and that's very important because you have the normal person has at least 15 to 20 meals a week, and every time you put that fork in your mouth or that spoon in your mouth with something on it, you have to think, what is it? Is it a real food that I'm eating with real nutritious value, or is it just some processed food or food-like substance with 25 ingredients in it that I'm taking into my body and expecting my body to take nourishment from it? So functional medicine puts a lot of emphasis on your intake of food and what types of foods you take, because that affects the root elements of your experience in health. Whether you're taking too much sugar, whether you're taking too much carbohydrates or fats, there's always a push and a trend for balance. And each type of food category has different effects on your health. So this is very important to keep in mind. And then also the other big issue is stress. For functional medicine, if you're someone who's under a lot of stress, that stress can lead to inflammation in the body. So not only inflammation, but the stress. If we look at this diagram now that's on, if you look at the root causes of problems, of different symptoms and diseases which are in the branches, if you look at the roots, we start with, on the right side, with poor digestion. Digestion is affected by, these, what we call toxic thoughts, any type of stress that you have. And then, of course, genetics plays a role in it. Any type of trauma someone might have had, and it's unresolved trauma that always kind of nags at you. And then, of course, lack of exercise. Exercise is important. At least 20 to 30 minutes of a brisk walk daily, and where you can clear your mind and prioritize things in your life for yourself, and actually meditate and see what you want your life to be in terms of health. That's very important. And then, of course, we have the nutritional deficiencies, which come from nutrient deficiencies, and that's picking the right foods and the right fruits, vegetables, types of foods that you take. And on the other side of it, you have relationships that affect our psyche. And if it's constantly affecting our psyche, then that's going to have a biological manifestation with different symptoms in our health. So, and then also lack of sleep. Sleep is a very important part of health. That's a root cause of disease as well if you're not getting sufficient sleep, because it's during sleep where you have a lot of the rejuvenation and the repair of the body that takes place. A lot of the, for example, in children, growth hormone is stimulated during sleep. So if you want a child or if you want an adolescent to grow well, they need to have proper deep sleep. If they're not getting enough sleep, then that person will suffer from deficient growth patterns. Of course, toxins, toxins can be anything from smoking to alcohol to any type of drugs, any type of exogenous things that are detrimental for the body. And then in general, poor diet, the fast food diet that's prevalent. You're not really cooking good, wholesome food for yourself. you're getting things from outside all the time. Even restaurants, they don't use the best things. They'll use a lot of chemicals that'll make the food taste good, but it's not really wholesome because they're under time pressure to get something off the kitchen and sent out to the consumer very quickly. So they don't really spend time cooking properly and picking the best type of nutrients and nutritiously dense foods for you. And then, of course, I mentioned stress already, and then, the basis of disease, inflammation. These things, in turn turn into, what you see in the symptoms as hormone imbalances, thyroid issues, autoimmune chronic diseases, the big ones, diabetes, heart disease, cancer. And this pandemic year, you're seeing a lot of anxiety as well, and a lot of increased hypertension or high blood pressure. And we see all these things manifesting, and we can't just treat them symptomatically by, just prescribing some medication for it. We have to see what the root cause is. And if you talk to your doctor during that history and physical, and allow them to kind of, find out what's going on or what's causing these things, then you have a better long-term solution for it. It's important to get rid of those root causes that are presenting as illness for you. Those are some of the differences where we focus on the roots rather than just symptoms and the disease. That's the approach of functional medicine. Functional medicine also has been, up and coming now so much that the Cleveland Clinic, which is a very famous clinic here in the U.S., has a whole functional medicine institute within the system there. And we have certain, fundamental systems and core clinical imbalances that functional medicine look at. And what they do is when you first go to a functional medicine appointment, what they do is they take a whole assessment of your health system, meaning that they don't just look at the one symptom that you're there for. They look at the holistic approach to your body. And number one thing that they look at is the concept of assimilation, which is stated here on the graphic that we have. And that assimilation is, it looks at your gut biome, meaning that how you're processing foods, how you're digesting foods, the absorption of it, the digestion, the GI, and then also how you're breathing and how you're taking in your oxygen and releasing the CO2. It's very important that those basic functions are healthy and they're not altered in any way. And then they look at defense and repair. Under defense and repair, of course, it's your immune system and also the inflammatory process in your body and whether you're prone to infections or not. Sometimes people will have an overgrowth of certain funguses in the body. They'll have certain repetitive viral infections. They'll have bacterial infections. There's someone that gets the flu or gets a sore throat and things like this that requires antibiotics 2-3 times a year. So they have to get to the root of that. It's important to find out what's going on with that. And then they look at your overall energy levels. It's very important because the energy in the body is a function of your mitochondria, which is a cellular component. And it's very important to see that that's functional and that you're doing well with that. And, with that, then they'll look at your biotransformation and elimination, meaning your detox and then detoxification to see what you have if there's excess of anything. A lot of people, for example, because they're healthy, they eat a lot of fish, but at the same time, they have mercury levels in their body that have been skyrocketing, and that has other effects. You get mercury poisoning or toxins and things like that, and we have to keep a sort of an eye on that to make sure that there aren't metals in your body, there's not lead and other things, because there's a lot of things environmentally that we see. And then after that, the communication system in the body, which is your endocrine, your neurotransmitters, your immune messengers, and then how is your cognition? Is your cognition intact and functional? Are you not having short-term memory issues? Are you remembering things? Are you functioning properly? These are things that we look at, and the functional medicine doctor will analyze that. And also in terms of your transport, they look at your lymphatic system and your cardiovascular system to make sure that everything is flowing smoothly. And finally, they look at the subcellular membranes and the musculoskeletal system to make sure that your body has structural integrity, meaning that the infrastructure of the body in terms of the bones and the cellular membranes and the functioning and the movement of the cells are correctly happening. So these are the important things. And again, at the base of the tree, above the roots, you have the mental, emotional, and spiritual influences. Then you have the genetic predisposition, and then also, your attitudes, your beliefs, and your experiences have a huge impact on your health as well. It's very important to keep that in mind. If you're always living in fear of getting a disease, or you're hypervigilant and you can't let your body really relax a little bit, then that's a constant stressor in itself on the body, and that makes you prone to disease. So these things are important, and that's basically the gist of functional medicine and what it is. You'll see more and more doctors take principles of functional medicine and incorporate it into their practice as it's becoming more and more mainstream. A lot of the public as well are reading and becoming more informed about functional medicine. And of course, anybody that's going to a doctor, of course you want to treat the root cause of your problem, right? Nobody just wants symptomatic coverage with some medication that just covers the symptom for a time, and then the root cause is still there. I mean, it makes logical sense for for anyone to find the root cause of the disease or the symptom that they're going to the doctor for. And to recap and to kind of summarize again, the differences: functional medicine, patient-centered, it's a personalized approach. It doesn't look at the averages, it looks at more of the individual and tries to customize the treatment for the individual. The view is that the body operates as an integrated system, and the body is not a collection of parts operating independently as we traditionally dealt with it. And then also the other difference is that gene expression based on the foods that you eat, the exercise that you do, can be altered. So functional medicine and its practitioners believe that gene expression can be altered as you live your life and you make changes. As opposed to conventional medicine, they say that the genetic expression is not changeable. So, and then in functional medicine, health is about vitality and being alive and being functional, whereas in conventional medicine, health was defined as the absence of disease. So those are basic differences. As I stated earlier, you'll see more and more functional medicine principles being utilized in your doctor's office. Many doctors are becoming more aware of this, of these new sciences, and it's something which is, I think, it's a breath of fresh air for the profession, where a lot of doctors can focus on the root causes of these diseases and try to help the patient and individuals change those root issues that cause these diseases. That's very important because we conventionally we were always focused on the disease, and we do a lot of symptom management. But now we can at least try to find the root causes and come up with strategies to address it at that level. That's very important. And we'll discuss more disease-specific cases, maybe with diabetes and cancer and heart disease and these things, and how functional medicine and conventional medicine, or the mixture of both, function to present with solutions for clients and for patients and for society in general. It's very important to keep in mind. And again, for treatment, it's very important because, food is very important. Let thy food be thy medicine. Your sleep patterns, your exercise patterns, and then also the nutrients and supplements that you take. It's important for them to be quality things and that you're not deficient in basic nutrients, and that requires some biochemical testing. So these things, you need to focus on. And if you do have some information that you need on functional medicine, or if you have some issue that you need a referral for in terms of, learning who does functional medicine in your local area, we can provide that for you. If you leave comments in the comments section, we can help you with that, and then get you on your way to, feeling better and taking care of yourself in a holistic way. With that, I think we've spoken enough about functional medicine for today. Thank you for listening, and we hope you share and like our videos. And we'll see you next week. You guys have a great week. Thank you for listening, and have a great day.